Knock knock. Hi, I'm Emily. I'm going to be your nurse today. Can you tell me your name, date of birth? All right. So I'm going to go ahead, go over a little bit of why you're here. We're going to do an assessment on you, so I can put that in the computer. And I'm also going to go ahead and give you some medication that's been prescribed by the doctor. And then I will answer any questions that you have. Alrighty. All right, so I'm going to go ahead and do a little assessment on you first. Your temperature was 99.8. Your heart rate is 103. Your respirations are 16. Blood pressure 118 over 68. Your O2 stat is your oxygen, and that was 96% on room air. And your pain is a 6 out of 10. It's what you reported when you got here, right? Okay, so we'll go ahead and take care of that pain here in a little bit as well. And we'll give you some hydrocodone that the doctor's prescribed, and then we'll go from there and see how your pain's tolerated, okay? All right, so I'm going to go ahead and just give you a little checkout, look at your skin, make sure you don't have anything that is concerning, okay? Then we'll talk about those orders that the doctor's prescribed. So I'm going to go ahead and look at your neck. What I'm checking for is JVD, that's jugular vein distension. We get that when you got some fluid overload, okay? And it doesn't look like you're having any of that. So I'm going to go ahead and feel your arms. I'm checking to see what your skin feels like, if it's wet. Checking for edema. And looking at your IV site. The IV site looks great. There is no kinking in the tubing. It's running fine. She doesn't have a catheter, so I don't need to check that. But if she did, I would check for the kinking in the tubing, making sure it's on an immobile part of the bed. Look at her surroundings, making sure that she is able to walk to the bathroom without any obstacles in her way. Her room is well lit. The curtains are open, so she is able to see where she needs to go. So making sure that she is able to get where she needs to go without any complications, okay? I'm going to go ahead and take a look at your stomach. I'm going to look at or listen to your heart sounds and your lung sounds, okay? I'm going to do 8 points on the front and 10 on the back when listening to your lungs. Alrighty. So you do have S1 and S2 normal heart sounds. Your lungs sound good for the most part. There is a slight crackle in your lungs, but we can get that fixed here for you with some of your medicine, get you some fluid in you, okay? I'm going to go ahead and take a look at your stomach. Her stomach is flat. It's not distended. It's got some tenderness to it because she did complain of abdominal pain when she came in, and that's what the 6 out of 10 is on her. So I'm going to go ahead and palpate your stomach after I listen to it, and just let me know if there is any tenderness or if it hurts too much, okay? Alright, so bowel sounds are only ×2, but that would explain your little bowel obstruction that we did find when you came in. So I'm going to go ahead and palpate to make sure there is no hard lumps in your stomach, which you don't have any of that, so that's a good thing. I'm going to have you push down on my hands and pull up on my hands. I'm going to check your cap refill. This just shows if you're getting enough circulation to your fingertips. It needs to be less than 3 seconds, which it is. I'm going to go ahead and check your legs for edema. Your legs, again, are warm, pink, and dry. Your cap refill on your toes, same thing, shows the circulation, which is less than 3. You do have a pulse present in your pedal. Have you push down and push up. Alright, sounds good. So there is no edema in her arms or in her ankles, which is a good sign. She has no JVD, so there shows there is no fluid overload. Okay. So we're going to talk a little bit why you're here, what we're going to do for you, and how we're going to get you better, okay? So you came in with, again, some nausea, vomiting, with some abdominal pain for the last couple days. We're going to give that CT scan with some IV contrast, and that showed your small bladder bowel obstruction. So we're going to keep you on some continuous telemetry, strict INO. You're going to keep your O2 stat above 92%, which it is currently, but we're going to have some oxygen therapy there in case if it does drop below 92%. And we're going to keep you NPO for right now, and we're going to give you some hydrocodone acetaminophen 5-325, and that's going to be changed to IV push 1 milligram every 3 hours as needed for your pain, okay, since we did change it to NPO. And then we're going to give you some medication for nausea, but I got to go back to the doctor and have him rewrite that because it was incomplete. So I'm not going to give that to you right now until I get some clarification on that order. All right. So some assessments that I'm going to be continuously monitoring on you is going to be abdominal, your heart and lung sounds for those crackles that I did here. We're going to keep checking your skin for any redness because you are on strict INO measurements and you aren't going to be getting up as often. And we're going to try to take care of that pain and keep on top of your pain so that you're not experiencing any of that, or it's a lot less, okay? And that's what that hydrocodone acetaminophen is going to do for you, is it's going to help with that pain. So we're going to make sure that we're also taking you to the restroom quite often because you have avoided yet today. So I will take you to the bathroom right before I give you some medication, okay? So I'm going to go ahead, go get my doctor's order, look into what medications I have to give you and what I need to give you, and then I will be back to give you some, take you to the bathroom and see what we can do for you, okay? Knock knock, it's Emily, I'm back again. Can you tell me your name and date of birth? And do you have any allergies, Miss Farley? No? Okay, I'm just going to go ahead and take a look at your wristband to double check that it matches what's in the MAR and the computer and what you just told me and what it does. We're going to go ahead and give you your pain medication since you did rate your pain 6 out of 10. And then we'll go ahead and take you to the bathroom in about 15 minutes after it starts working, okay? So I'm going to go ahead. I need some gloves. I need a flush. I would use a normal syringe like this one, but this needle is capped, so we're just going to go ahead and use my 1 milliliter syringe, which would be a TB syringe, and I'm going to go grab her medication. Okay. So her medication is going to be the hydrocodone acetaminophen, and I'm looking at the bottle here, comparing it to my MAR that's in front of me, and it is the same as what is in the computer as the doctor's order. The name of the medication matches up with the correct dosage. Her name matches with the MAR, what is also on the doctor's order as well. So I'm going to go ahead and put my gloves on. So she already has a port running of her IV, so I would take that port that is closest to her, and I would make sure to clean it off with an alcohol swab. I'm going to take my 0.9 normal saline to flush with, to make sure that it is patent. I'm going to then take another alcohol swab, clean the top of my medication bottle, take the cap off. I want 1 milliliter of medication. Going to instill air of 1 milliliter. Flip and draw up 1 milliliter. Okay. So I have my 1 milliliter. I would then again clean off the port and inject this 1 whole milliliter of medication in. I would document the date, the time, how much medication I give, how the patient tolerated it, the way that I gave the medication, and then I would document that she had no known allergies to the medication as well. And then I will go ahead and let you have about 15 minutes or so to let that medication kick in. And then if you don't have to go to the bathroom right now, we'll go ahead and take you in about 15 minutes to help with that pain and when you get up, okay? All right. All right, knock, knock. It's Emily. It's been about 15 minutes. Are you ready to get up and go to the restroom? All right, so we'll go ahead and take you to the bathroom. She did void 200 milliliters of very dark concentrated urine. So we're going to go ahead and pass that on to the healthcare provider, let him know that it was very concentrated, and then we'll also let the oncoming nurse know that they need to document and take you to the bathroom frequently and look at your urine and document that, okay? So we're going to go ahead and do a renal function panel on you because your urine is so dark. And what that's going to do is just check to see if your kidneys are functioning correctly, and then we'll get a diagnosis of what kind of you're here for and why this stuff is happening, okay? So we're going to go ahead and draw that up, and they'll come back in a little bit, and then I will go over those test results with you. But we're going to go ahead and put on your O2, your oxygen, because your O2 stat has dropped to 90 or 89%, okay? So we're going to put that on, and then I will go gather the supplies that I need to give you your normal saline bolus, okay? Alrighty. Can you tell me your name, date of birth? And do you have any allergies? No? Alright. So I'm going to go ahead and take my 0.9 normal saline. We're going to give her a 500 milliliter bolus over 1 hour. I'm going to need my primary tubing. I need an alcohol swab and a saline flush. I'm going to go ahead and take her saline lock, and I'm going to clean it off and do a flush to the saline lock to make sure it's not infiltrated. I will then take my normal saline. I will spike the bag, squeeze the chamber to fill up, make sure that my roller clamp is clamped, and then I will unroll the clamp and let it prime. Okay. And then I'm going to take this end and I'm going to hook it to my PRN adapter and allow this to run at 500 milliliters for 1 hour. So this whole bag will infuse over 1 hour. I want to make sure that I put the patient's name, what type of drug, the amount, who put it up, the date, the start time, the end time, and the flow rate that it is going on this medication. I would then, once hooked into the PRN adapter, I would unroll my clamp and allow this to flow. I want to double check that it is flowing the way that it needs to be do, and I can check that by in the chamber watching it drip. Okay. I would then come back in a little bit to check and make sure that the pain medication is working. She doesn't having any adverse reactions. So with that pain medication, you can have some confusion, dizziness. You can get pretty tired. You can have some hypertension, some more nausea, and some constipation. So just let me know if you have any of those symptoms, and we'll stop and do some assessments on you. So since your renal function panel has come back, your BUN was 56, your sodium was 132, your creatinine was 3.6, your magnesium was 1.4, potassium was 1.5. So we're going to make sure that you are drinking enough fluids to push that through your system and try to take off any of that fluid that you are holding on to. And we could maybe expect to have a diuretic given to take off any excess fluid. So with your lab results, it does come back that you have acute kidney failure, and that could be from the contrast dye and it has damaged your kidneys. So we're just going to keep you in here and monitor you for a little while, and then let this normal saline run through, and then the doctor will come back in and talk to you, okay? Do you have any questions for me? All right, well, if you have anything that you come up with or you start feeling a little off, go ahead and push that call light, and I'll be in to check on you, okay?